Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Do you have more time than we originally stated? Because we have so much more ground to cover, and I would love to continue this conversation. Okay, great. Let's do it. So can we talk about the Ames method? Because I had read that in one of your articles, and I thought that was so cool. So that's specifically for vaccine communication, but I think it can be used for anything.
Look, there's tons of different methodologies. There's motivational interviewing. This is not that. I don't do motivational interviewing. I know there's a huge field of science behind it. I know that people say there's good data that, it can work. And
it's hard. It's hard to do. You got to be really trained in it. Like you can't just pick up a book and be like, all right, I'll start doing this.
Trained, practice, and it takes time. And as we said, everybody's under a time crunch. Dr. Noel Brewer from Chapel Hill, UNC, does some great work on different science behind communication. Ames happened to be out of two researchers that I know, John Parrish-Sproul out of Indiana University, and also Dr. Angus Thompson as well, really worked on Ames, which is just a mnemonic around making recommendations, in this case for a health intervention. Could be used vaccines, could be used for testing or anything else, but it's making a strong recommendation, right? If it's evidence-based and you believe in it, just like car seats, I wouldn't say, do you want to put your kid in a car seat or do you want to put him on the roof? I don't know. No, I would say, look, the data says you should put your kid in a car seat rear facing, right? The data is really clear that if your kid's in that car seat facing rear, chance if there's a collision that they'll be safe or avoid serious harm is clearly drawn out. I wouldn't make that as an unequivocal, do you want to put your kid in a car seat? I would say pretty straight up. So same thing for a vaccination, whatever. Make a presumptive recommendation. If they say, yeah, that makes sense, great. If they have questions, absolutely answer the questions. If after the questions or after a little bit of discussion, they're not sure, I inquire. So the AIM stands for announce, inquire, mirror, and secure. So I make the announcement. They have questions. Great. They still aren't sure. Inquire. Can I find out a little more? What's concerning you about this? I'd love to learn more. Sincerely, I would love to learn more. In pediatrics, we have long-standing relationships with our patients, sometimes decades, particularly if it's siblings or sometimes longer than that, if it's kids of kids. So, inquire. Okay, so now I understand. Like the one example I've given that was vaccine related was HPV. I'll go back to that. Mrs. Jones, Sally's due today. She's our 11-year exam. We just did it. It's great. She's due today for her TDAP or HPV and her meningitis. Mrs. Jones says, I know about the TDAP and the meningitis. That one really scares me. Not so sure about that middle one. Inquire. Mrs. Jones, please, I would love to know more. What's concerning you about that? Because we just talked about why, it's definitely an important vaccine to get. My sister-in-law posted on Facebook that's the one that can sterilize kids. Mrs. Jones, let me make sure I got this straight. You heard or saw on Facebook your sister-in-law post saying that the HPV vaccination can sterilize kids. Is that right? Active listening, letting her know I know what's scaring or worrying her.
Hold on, though, because I feel like that could be misconstrued as incredulousness, right? Like, let me just get that right. That you heard from your sister. She read on Facebook that HPV can cause the kid to become sterile. Could be construed as you doubting them. You know what I mean? Instead of acknowledging their fears.
Yeah, I would imagine it's intonation, body language. It's just like you saying to me, so anyway, we went down to that store and we bought a Labradoodle. And I'd say, wait, I just want to make sure I got this straight. You went to that store, I'm just...
You bought a Labradoodle?
If you said it that way, then it would be like, what, you got something with the Labradoodle? I'm just literally inquiring and making sure I have it right. So I think your intonation, your body language, and everything you know from communication, and this is regular day-to-day communication, will set the tone for what that question's like. So I want to get this straight, just so I understand where you heard this. It was your sister-in-law that posted on Facebook that said that HPV causes sterility or infertility. Is that correct? Yeah, that's where I heard it. And that gives me a chance to actually do what I love to do, which is care for my patients and express some empathy when I know they're worried, right? Everybody's at their most vulnerable when they're sick, or even worse, when their kid's sick or they're worried about their kid's health. And so therein lies an opportunity to say, if I thought that was true, that would scare the hell out of me as well, right? You could take a moment without magnifying that inaccuracy by affirming that that's really scary information.
Yeah.
You can then follow it up and say, can I tell you why I got my kids vaccinated with the HPV vaccine? Or, if you don't have kids, your nephew that you recommended it or whatever. And therein at least gives the opportunity to acknowledge that's scary. Now, let me give you a little more information and let's see if you feel comfortable after I can address that concern that took a little while to get to. And by the way, healthcare providers who aren't trained in communication best practices tend to do two things in a knee-jerk fashion. When they make a recommendation, if somebody doesn't say, yeah, okay, we'll go ahead and do that, they do two things that's almost kind of like knee-jerk. One, they'll go right to the data. Let me tell you, there's this one study, it has 95% confidence intervals. It's incredibly compelling. It's like you're talking to a resident, right? Or a medical student or something. That's not your patient or their family. The other thing is the healthcare provider may become incredulous and say, if you don't get this, this is what could happen. And they show something scary, right? Maybe a scary picture or, death rates or something that shows like, if you don't do what I'm saying, bad things could happen. Somebody who's already concerned isn't going to be swayed by being scared or data being thrown at them. As a matter of fact, they're vulnerable and scared because they're scared. So that's a great time to just be sincere. I went into healthcare because I wanted to take care of people, and the ability to have empathy and compassion and say that would scare me too, then offering up something like why you believe in it. And then you can get to the data. You can say, I would never, which is always true. I've always said this to my patients. I would never recommend something to you or your kid that I would have done for my own kid or my own family, which has been true across the board. Anything I've recommended, my kids got, or I've gotten myself. And finally, at the end of all that, say you go through all that and they're like, I'm just not sure about that. Secure the relationship. You know what? First off, I'm just really appreciative that you talked through this with me because I learned more about what was on your mind. I appreciate you letting me explain why I think it's important. We can revisit it in another visit, but I just appreciate you coming in here and letting me, help take care of your family and make recommendations. It doesn't mean you're always going to accept it, but thanks. And we'll follow it up at the next visit.
Hold on. There's a little piece there that I just want to clarify, and that's responding to their misinformation, right? So they just presented you with this misinformation about the HPV vaccine leading to sterility, right? You said that's really scary. So acknowledge their fears. You are making sure that they see you as someone who is like them, right? But you're making yourself more like them and therefore more part of their tribe and therefore more trustworthy by saying, but you didn't respond to the misinformation. Do you need to do that, or do you just acknowledge their fear and still continue to make the recommendation?
Well, I would certainly, after expressing empathy, and again, I'm not doing anything that wouldn't be sincere here. If they're scared, I definitely want to acknowledge and see if I can find that space. And I could say that is scary because it is scary to think, holy crap, could I make my kid sterile by giving them this, right? It's called inaction bias. I'd rather not do something that can hurt my kid than do something that might help them. But oh my God, I'm hearing all these scary things. I certainly don't want to be the reason that they became sterile, right? So
they make their decision by not making a decision.
Every decision or indecision or lack of decision is still a decision. I just want them to understand, yeah, that's scary. But when I go on to say, can I tell you why I immunized my kid? And then I may be able to get to data at that point and say, now that I see what's concerning you, let me tell you about some data, because infertility is something that a lot of people have asked about because there's a lot of inaccurate information out there. Matter of fact, we call infertility a zombie myth because it comes up again and again for vaccines, for medications, all the time. Oftentimes because guess what? It's sensational and it scares the shit out of people.
Yeah.
And because social media delivers you your own personal slice of hell, it knows if you have a kid of childbearing age and you are ripe to be delivered something that talks about fertility because it's relevant to your fears. And that's what social media does through micro-targeting and geo-targeting and demographic targeting. It delivers stuff that's absolutely scary to you because you are then more likely to click and share and like. That's what algorithms are all about.
Yeah, like when Amazon knows that there's a flu pandemic happening before we have data because they know what people are buying, or, they know that you're pregnant before you do because of the stuff that you're buying. It's really terrifying. And terrifying.
It is terrifying and terrifying at the same time.
So could you just go through AIMS one more time, what that acronym stands for?
Yeah. So it's announce, inquire, mirror, and secure. It's certainly not the only communication methodology, but it's one that's easy that I've certainly been able to work with a variety of different audiences to teach. And frankly, a lot of healthcare providers have have verbalized to me, I go into exam rooms without any strategy about how to proceed with whatever the recommendation I'm making. Maybe it's a surgical procedure, maybe it's a medication, maybe it's a vaccine. And they go in like, I've not been trained on this. I'm not really, sure what I will do. I will just make a recommendation. But nowadays, I think people are so put off with different types of information that's being thrown around on social media and digital sources that they may feel reluctant to make any recommendation because they're like, I just don't want to deal with it. And that's a horrible thing to do because you are an expert and paid to provide your expertise. And so you make this half-hearted kind of recommendation to just check the box that you recommended, whatever it is, sunscreen, car seats, vaccinations, whatever it is, instead of saying, no, I feel strongly about this. I'm going to make a recommendation. And I am prepared that if you have questions, that I answer them. And then if you still aren't certain after I've given the answers, I still have a thought process with which to communicate with you. I take the emotion out of it. I know that you may be worried. I'm not, everybody's like, oh, they might get mad at me for making a recommendation. Well, holy crap then, smoke. Don't put your kid in a car seat. I mean, if we're not going to make recommendations that we know that keep our patients safe, I don't know that medicine's the right place. Like, that's what we do. The majority of our job now is behavior change, right? If you look at the impact on health from straight up healthcare, fancier PET scanners, nicer hospitals, prettier clinics, has a 10% impact on outcome. If you look at social determinants like housing and food and environmental health, that's about 20%. Maybe 30% they say is genetics and 40% is behavior. And if you believe in epigenetics, then if you can impact behavior, you might even be impacting that 30% of genetics. So 70% plus can be impacted by behavior change, like don't juul, don't chew tobacco, wear a seatbelt, don't have unprotected sex. Like that, we know that those things are going to have impacts on your ultimate health. The fancy diagnostic stuff and the exams and all the things we do in the room are pretty limited in the grand scope of things.
Which is why we should be leveraging behavioral economics to help people make those right decisions, right? We're the scientists. We're the ones who know this information, although we're swimming upstream, because I was reading about this smart cow theory, or the smart cow idea is like they're all trapped in the pasture and you just need one smart cow to figure out how to unlock the gate, and now they can all exit, right? But unfortunately, we live in a world where there are a lot of cows actively closing the gate now too. And so if we're, for all the discoveries that we make on how to influence people into making the right decisions, they're going to be nefarious actors trying to push them back, but that shouldn't stop us from doing that. So that's an excellent point. We should be leveraging that more. We should be putting more research into helping people make those decisions.
Well, I think innately, we tend to have trust, which is a precious asset that we should build upon, but we squander it. And if you have pastures, healthcare's the stupid pasture, again, because the gate's been opened by the Starbucks cow and the Amazon and the Disney cow. Yes. They realize, for those of you that may not be in the business field from the healthcare side, a positive ROI, a positive return on investment. For every dollar spent in their digital communication, they realize more than $1 returned, which means they collectively put in hundreds of billions of dollars into digital communication, which is scalable and relatively cheap at a per person or per impression cost. And they can get people to buy coffee. They can get people to buy a certain car. They can get people to use their rug cleaning service. And yet here we are still not putting two and two together to figure out, wow, I wish more people didn't, go outside without sunscreen.
This is a different conversation, so I don't want to get us too far off track, but there is an ethical question there. Are we subliminally influencing decision-making? Is that an ethical thing to do? Right? I think that's a whole episode in and of itself. But
I'm not a bioethicist, but I would tell you that we took an oath to do no harm. And so if the evidence supports the recommendation we're making, I don't think it should be subliminal. I think it should be damn right overt.
Liminal. Liminal, not subliminal.
I believe this is what you should do for your health to be at the best possible path that you can take, or for your child's health. I believe, again, that a seatbelt's a really important thing, that not using tobacco is a really important thing. Pick whatever your recommendation is. So if we're using a digital delivery to reinforce our face-to-face communication, I don't see anything unethical about that, as long as what we're doing based on the science is the best recommendation we have available.
One thing I want to mention, you said Bueller, and that's Ben Stein, who's an economist. I think he worked in the Nixon administration. He just gave that talk impromptu, right? Like I think just on the spot, just started giving a lecture, right? In Ferris Bueller's Day Off. Yeah. That lecture, I want you to go back and listen to it because it's about how tariffs were ineffective during the Great Depression at, building back the U.S. economy.
I haven't re-listened to it, but I saw that there was something written about that.
Tariffs don't work. And as we're talking about this, the current administration is trying to put tariffs on our presumed allies to coax them into, so just, it was interesting that lectures on tariffs don't work. So,
yeah, I will say, look, if we're going to, obviously we cross a little line to make the reference of politics, right? I mean, politics sadly has mixed with science, which I think has been horrific. I've taken care of both in person and digitally tens of thousands of patients, who knows, hundreds of thousands of visits over the last 30 years, either directly or through phone calls, things like that. I've never asked somebody their religion. I've never asked somebody their politics. And frankly, that isn't an issue. I want my patients and I want their families to do as well as they can. I think it's a bipartisan thing for people to want to be healthy, for their kids to be healthy. Sadly, because of things like social media and politics, things become very polarized. And the fact that science has gotten thrown in there and healthcare has gotten thrown in there, it's problematic because we have seen recommendations or things that the science supports getting thrown into these meat grinders of digital and political polarization. And it causes confusion, right? People do that because it may get them an extra vote or it may make somebody get a competitive edge. But at the end of the day, we're talking about people's health. And so I will let you know that what I believe is the right path forward is not, when it comes to politics in my mind, a right side. It's about building a bigger middle where we all can agree that we want to learn about the best way to stay healthy. I think that sadly, with this polarization that's occurred, it's about us and them. And I think way more than half of the U.S. populace is in this middle that wants just accurate information to help stay healthy and help their kids be healthy. And I'm here for that.
Agreed. I mean, one side of the aisle wants a lot of the things under government control, right? Because capitalism, unfettered, is going to look out for itself and only itself, and is not going to look out for waste byproducts or dangerous engineering. It's only going to look for profits, right? And unfettered capitalism. But at the same time, unfettered bureaucracy leads to inefficient spending. And so where's the middle ground? They both need to balance each other out, and they meet in the middle. So agreed. I think they stay in power because in order to get votes, they need to villainize the other side, right? That's how you get the votes is look how terrible look how ridiculous they are.
It's created an us-them situation, but sadly.
But we agree on so much. There's so much we agree on, and we can't get that stuff done because.
Well, I think we see the turn that politics has taken into polarizing things that may have been left alone before, such as health.
Yeah.
And then when you throw on top of that the influence and impact of social media, and by the way, I am not here to defend about the virtues of social media. I think if we had choices, we would get rid of social media altogether. Matter of fact, teens, there was some studies I saw about teens saying, would you be willing to get rid of your social media use and exposure and everything? And there was the answer was yes, because I don't want to be left out, right? That's the whole, as a teen, I thank the Lord I grew up at a time without social media, because you only had to worry about what was said in school that day. And maybe somebody made a phone call, let alone somebody, 24/7, your life was on display as a kid.
And if you had to make that phone call, you had to speak to that person's mom or dad when they picked up the phone. You couldn't just be like, hello, Mrs. Wolynn, can I speak to Todd, please? Right? Like it wasn't like.
And we didn't even have cordless phones then. You had to be tethered to a cord.
Exactly. You could only go so far because of where the cord reached. But you're getting to something that I want to touch on. And that is there anything you've learned about health communication, especially online, that could translate to politics, that can help us be better communicators? Healthcare has become politicized. And often you can know who's going to push back against vaccination because they happen to be wearing certain clothes or something on their wrist that shows. But how do we widen the tent?
Yeah, I think, regardless of whether it's vaccination or it's vitamins or it's, whatever the topic is that might be a recommendation, I think that the online piece comes in the form of a communication resource that's underutilized in healthcare. So you and I just got done talking earlier in the podcast here about the benefit of being a better face-to-face communicator. And we used an example of AIMS as one methodology. Sure, that's great, but it's not scalable. You can only see 20 patients a day or 30, or I know some seriously productive people that say they'll see 40 or 50 patients a day. I don't know how they do that,
No.
But none of that's scalable. You can't see thousands of patients per day, but you can virtually. And so the question that you asked, how can we use online resources to address the polarization? And the answer is by building upon that trust that we have with both in-person or face-to-face communication that's combined with and supported by a digital online resource. Your families, your patients want to hear what you have to say, but this is no longer 1990. They very well may go to your website. By the way, your website better be good. We started in 2010 taking our show on the road and talking in grand rounds. At that point in 2010, I think it was like 50 to 75% of the practices even had a website.
You mean on the World Wide Web?
A World Wide Web back in 2010. And several of them were like, horrible. Like they looked as if they were out of the 80s. You had to kind of enlarge them with your fingers. They weren't adaptive to the size of the screen you were on. They certainly weren't built up for phones. So I would tell you this generation will judge you on what your website looks like, how navigable it is, and is it appealing and engaging. But beyond that, we also have to use video. We also have to use social. And, we would get questions like, well, what social media platform? And they heard we had a communications director and they said, well, we can't do that. I'm like, really? I think you can. And as a matter of fact, I think in 2025, if you don't, you're literally breaching the abandonment of patients, because now your patients are hearing you're not. And while that's different than, abandoning a patient typically is thought of like
like
patients,
you're firing them and they've got nowhere to go. And
right, nowhere to go. But I would say if you're not where they are, you are abandoning them. And so if you really want to have an impact on their health, you need to be where they're at. You don't need to be on every social platform, but you may want to survey your practice and see where most people are. So if most people are on Instagram, then go to Instagram. If most people are on TikTok, go to TikTok. If most people are on, some other platform, I think that's a great place to start. So yeah, I think that we need to think differently. We aren't trained to communicate well. And I think there's a true need, a paradigm shift that has to occur in healthcare, that pheochromocytomas are important to learn about, but they better be as much time preparing for how to communicate effectively as we are for identifying something that's like a 2 to 8 per million incidents.
So we talked a little about politics, and your energy is infectious, right? And, we think alike on so many things, and it's so much fun talking to you. But then I'm going to open those same social media apps, and it's going to be scary. It's going to be depressing. So I want to end on what gives you hope. What gives you hope?
What gives me hope is that I think we are all much more alike than we are different, and that we are just not trained to be able to reach that piece inside of all of us. We already know the hope that I absolutely have as executive director of the Trusted Messenger program is that we are innately trusted, that we have trust. And again, let's remember, nobody should be writing our narrative. When people are like, oh, I don't know if I want to make that recommendation because, people are saying like it magnetizes you, or, pharma's in bed with government and government's in bed with doctors. Like, no, don't let somebody write that script. Mrs. Jones, I took care of Sally's laceration on her knee when she was 2. And we took care of that pneumonia when she was 6. We've talked about sunscreen and other preventative things. Everything I've recommended for the last 11 years has been evidence-based. And it's been the same stuff that I would have done for my kid, right? Reset the tone back to, we have a long-standing, longitudinal trusted relationship. And so what gives me hope is that we still have trust, that we are capable of becoming better communicators. We have amazing resources within our grasp that are not difficult to access. But let's recognize in 2025, to reach people and to do so in a compelling way, we have to be better communicators across the board. And that's why I'm so excited at this point in my career that I have something that allows me to continue to help people and hopefully to help healthcare providers help their patients. So I think that while there's a lot of frustration, I think that medical schools and nursing schools and pharmacy schools and residencies and health centers all need to adapt and evolve and lose that tail. As you said, we can't be going at a glacial pace. We can't wait for like another ice age or some other cataclysmic event. We need to just recognize our patients are waiting to hear from us. They're waiting for us to be able to listen to them, and we have the tools to do so. We just need to access them.
So if people want to find you or they want to learn more about the Trusted Messenger program or both, so you said there needs to be a great website and it needs to be accessible on your phone. So where do we find that?
So that is up and coming. I am 2 weeks
yet. What?
Yeah, I'm 3 weeks into it. So Public Good Projects has their website. We are literally getting ours up and running and our social channels. So I will absolutely follow up and give you more info, and hopefully we can tag it onto this episode. But as we speak, the Trusted Messenger program doesn't yet have its website because we're only 2 weeks in, and we want to make sure it's a good one. And we also want to make our digital good. But, if anybody who's listening to this wants to learn more, you can always look me up on LinkedIn, the only Dr. Todd Wolynn that I know on there. And I'm happy to talk more about it. I will be pushing out more content as these channels go up and live. But I'm a little over, well, now I guess I'm actually 4 weeks in. So get new in the role, but excited and more to come.
And we're excited to have you there. So Dr. Todd, thank you so much for all you do for your patients and for our profession.
Well, thank you again for having me on.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.